about my first years and where I grew up and where I studied, about my university, my hospital, and some years I did abroad. Then about my residency and some of the periods I've been away, like coming to Asan Center, and then a bit about our hospital. So, my first years. I was born in Leon and I've lived most of my childhood there. It's a small city in the north of Spain, famous for its cathedral and its cold weather, and a bit about the food. So the cathedral is famous mainly for the stained glass, but then we also have some very beautiful landscapes and a lot of, as I said, a lot of food in general, a lot of tapas. So if you come, you must visit. Then I spent one of my years in Minnesota learning a bit of English when I was around 13 years old, so in 2010. Living between Minneapolis and St. Paul. And then I want to pay a bit of a tribute to a professor I had that actually passed away last year. That was the first one who told me I'd be a nice doctor, so very grateful to him. He was the first one to give me the idea. Then I went to university, also in the well. I first did 1 year of pharmacology in Madrid because my mother is a pharmacologist, so I wasn't really sure what to do with my degree. So I started that. I was very happy, but then I wanted to go to art school as well. So I retook the university entrance exam to do both degrees at the same time, but I got a very good grade, so I switched to medicine. Then I went to Santander. It's a city up in the coast in the north of Spain as well. It has a very big hospital. It's very nice. That is up there. So it also has a very beautiful landscapes, as most of the north of Spain does, and some very nice villages. And then during those years, I wanted to do during the summer some time abroad. So I went for a month to Greece and to Poland to see how what hospitals work there, to pediatric surgery and cardiovascular surgery. And then I did a whole year in Portugal, in Coimbra. That is actually has the biggest hospital in the peninsula, so between Spain and Portugal. I was very surprised to find that. And then in 2021, I finished the degree, and we took the MIR, which is the entrance exam to choose both the specialization and the hospital you're gonna work in. Then I started in El Hospital Universitario de Burgos, which is also a city in the north of Spain that is famous for its cathedral at school, so it hasn't really changed that much for me. So it's a 5-year program, and I get to see, as most of them, as I said, a lot of landscapes and small villages around with a lot of waterfalls. So this is our hospital. It's kind of a big hospital for such a small city. It's still under construction in this picture, but you can see the size of it. We are a service of 11 attendings and 8 residents at the moment. This is my boss. So as you can see, most of them are very young attendings because we used to be very famous some time ago, and then all of those I think have been retiring for the past 10 years. So this recent 10 years, we've had a lot of people staying afterwards. And then what do we do at our service? So we are mostly specialized in hand surgery. We are actually the only official implant center in Spain. So we get calls from all over the peninsula and sometimes from the islands as well. But we do everything that is related to the hand. We do hand fractures, we do arthroscopy, we do, of course, any acute or chronic diseases of the hand. We do some breast surgery. We've never done much. We're starting to do a bit more with the DX flaps, but still I don't think we do as much breast as a usual breast plastic surgeon would do. And then we do everything in head and neck, because even though in most of Spain we have maxillofacial surgery, in my hospital there's not that service, so we do everything that they would do. So we do all the reconstructions, we do the facial fractures. What we don't do is pediatric malformations and orthognathic surgery. But then we do infections, facial palsy, something like that. We have a bit of shared pathology with ENT. And then we do a bit of everything else that is done in plastic surgery, lower limb reconstruction. We do some burns, but as long as they are not big burns, that everything is below 20%. And then some other things that are a bit less common. So what kind of population do we have? We have a very old population with a high soil exposure because of the agricultural fields mainly. So we do get a lot of patients with very long-term tumors that they haven't checked before because they are old and they don't think it's going to be a problem until it becomes too late. We also, as I said, we have some head and neck reconstructions and pharyngeal reconstructions and facial palsy. Sometimes use the Doppler, curiosities and tongue cancer. Perineal reconstruction for mandibula. But as I said, most of what we do is hand reconstructions and arthroscopy, a lot of fractures, a lot of acute cases and chronic cases and with arthrosis and stuff. And as I said, what we are most known for is the reimplantation and catastrophic hand kind of patients. So we have a few of hand reimplantations, but most of them, they just come a bit like this. So we do what we can to salvage some of the fingers. We do get some free flaps from that, some from time to time, or some hand to toe patients, but most of them is just very catastrophic hands in which you can just salvage and try to do a bit of second surgeries to get tenolyses and stuff like that. What are we missing in our center is mostly, as I said, burns. Once they are over 20% or a bit less if they're kids or in compromising areas. We don't do anything in transtheater. We only do the breast surgery. We don't do brachial plexus, and then we don't do pediatric surgery. The only thing we do is sometimes hand malformations, but they are not very common in our area particularly, so not a lot of that. Thank you very much.
And then out of this, they want me also to be in the orthopedic team.
Yeah.
He asked me to make a combination of both departments.
Yeah, no, the ones that are in hand are doing double everyone else.
Yeah.
It's true that most of the fractures and the emergency is done by the residents, so they don't do most of them.
So is it okay to upload this video to the YouTube?
So what do you want to do after the training?
After the training, I would like to probably remain in my hospital. I like it very much. I like hand surgery, but I mostly like microsurgery. So the good thing about hand surgery is you get a lot of microsurgery from the implants. So you get a lot of practice. But in our service, since we have a very big workload, we usually are in more than one department. So I can probably do a bit of both. So I'm very happy.
How do you think about staying in Asan? You want to recommend?
I would love to be in Asan. We were actually thinking about doing even a fellowship after this 2-month period because it's amazing. We're learning so much. Everything is very nice. Everyone is very nice. Everyone explains a lot. We're getting a lot of information back. Trying to bring back a lot of things.
Okay. Thank you. Thank you very much. Thank you.
Thank you.